Good morning, everyone, and happy Tuesday. Today I'm here because I want to talk about juvenile arthritis because a lot of my clients are seniors, but of those that have arthritis already, a lot of them are only in the 4 to 8 range, I would say. For those who don't know, juveniles are not babies, not puppies or kittens, and not seniors, but they're in the middle, and that age range depends on the size of your dog. Morning, Monica. So if you have a very big dog, for example, like a Great Dane, your juvenile range is going to be a lot smaller because typically they only live to 10 to 12. So your juvenile range would be 4 to 7, 3 to 7, rather than, for example, if you had a smaller dog, typically they live a lot longer. I've actually met 18-year-old Chihuahuas before. So in that case, the juvenile range could be 4 to 14, right? So it entirely depends on the size of your dog, and this is going to be really important when we get to the causes of juvenile arthritis. So symptoms include limping, holding their leg up, a stiff, awkward gait, kind of like they're walking on stilts, reluctance to exercise, which for most of us, we know our dogs could run all day. If they're not, then that's a really good sign that something's going on. A decreased interest in games. And Kaya's one, she has a short attention span when it comes to games, but I know that that's normal for her. So if I know that she doesn't want to play at all, then that could be something unusual. Excessive licking. This could either be at a spot on the body or stress licking. A lot of people don't know that one of the stress indicators is that the dog's repeatedly licking, whether it be licking their lips, like I just did, or licking their feet, their legs, a part of their body. Because I know a lot of dogs, they lick to the point that the hair starts to come off or they have a rash reaction. Yelping, sleeping more, muscle gain in the unaffected limbs. So if they start lifting up one leg, their opposite leg is going to get stronger because they're putting more weight on that side. So if you notice an uneven muscle distribution between one side and the other, that's also a good sign that one side is weaker. Bunny hopping, which is when they put more weight on their front legs than their back, and they kind of hop their back legs up to meet their front rather than having a smooth gait. Muscle loss over their hind limbs. Obviously, if they're not putting as much weight on them, they're not going to have as much muscle there. And atrophying muscle in the back end is really common. You'd be surprised, especially in bigger dogs, especially coming in pets with hip dysplasia. But we're going to get there. Slightly more aggressive behaviors, usually because the dog is in pain. And when they're in pain, they can get defensive. So if usually they're good with you playing with them and playing maybe a little more roughly than usual and suddenly they're not standing for it, it could be a good sign that something's going on. Now there are a few causes of juvenile arthritis. The most common is joint dysplasia, which is most common in dogs with abnormal growth plates. So typically these are the really big dogs like Great Danes because their body is forced to grow so fast. Their joint plates are actually not connected in the way that they should, and they're more prone to hip dysplasia. Hip dysplasia is also more common in German Shepherds. That's probably the most common example that you'll get from me. But there can be a lot of reasons for joint dysplasia. It could be a repetitive strain injury if it's a sporting dog. It could be trauma to a joint. So if they fell or tore something or had surgery or got hit by a car or something like that, that could be another reason why there's an early onset of arthritis, which is interesting now that I'm thinking about it because one of the younger dogs that I work on, she was probably about 5 or 6 when I started working on her, and she got backed into by a truck on her back legs, but because of that, she had to have surgery on her back legs, and she actually developed arthritis in one of her elbows on the front. because she was putting more weight on her front leg. But now that I'm thinking about it, that makes a lot of sense. The least common reason that would cause it is secondary to an infection. So if they get any kind of serious immune infection or even any kind of bone infection, which is really uncommon, but it's more common with open wounds, or any infection near a major bone that could also, or joint that could also cause juvenile arthritis. There are a few ways that you can help if you find out that your animal does have juvenile arthritis. The first is to manage their weight. If they're overweight, they're putting more stress on their joints, therefore they need regular exercise. But because that can be painful for them, we recommend more gentle exercise like swimming. So there are a lot of places, and actually I just saw a post a couple days ago about hydrotherapy. And I know there is one in, I want to say Ajax or Pickering, it's in that area. A lady that I know, and I used to work on her Chihuahua, she became a certified hydrotherapy instructor. And one of my other clients posted a photo of one of the dogs that she pet sits at this hydrotherapy place. So, small world. But hydrotherapy is really wonderful, especially for dogs with things like juvenile arthritis, regular arthritis, and any kind of bone injury or weakness. Supportive sleeping, making sure that they have a comfortable bed and place to sleep. If your dog is anything like mine, she will happily sleep on the queen bed, but she will also sleep on the wood floor. She's pretty flexible that way, but making sure that we lay out towels for her, because she's not really a bed type of dog. Making sure that she has that support. There's a lot of supportive beds you can buy. They're definitely more expensive depending on the size, but they're more like a mattress than an actual bed. Joint supplements, of course. If you are looking for joint supplements, send me a message. I'd be happy to talk to you about them. But there are a lot of things you can do nutrition-wise to help with the joints, including lubrication, strengthening the joints, strengthening the muscles, which will strengthen the bone and the leg itself, anything like that, and gentle exercise. So if anybody knows a dog with juvenile arthritis, feel free to send them this video if they want to see it. I highly recommend preventative supplements rather than starting it once the issue presents. So for example, if you have a dog or breed that you know is prone to a certain issue, for example, a German Shepherd, I would actually start giving them joint supplements earlier when they're a juvenile, because it will help prevent damage to the bone and they'll be less likely to get hip dysplasia, or at least the onset will be later. Monica says, when Willow goes to the kennel, she runs and runs. When she comes home, she can barely walk. She's only 2 years old. Will she be more prone to arthritis? If she has an injury while she's running, it's possible. I know Kaya's very much the same way. When she goes to camp, I once sent her for, I think it was 7 nights, and came back, she slept for 9 more nights after that. And she didn't want to go for walks, she didn't want to do anything, she was so tired. But can Willow, when you say she could barely walk, it means that she's walking slower? Does it mean that she's limping? Or is she just not that interested in going out? Because that would be the distinguishing. They're pretty good at telling us when something's wrong, unless they're purposely trying to hide it from us. So it entirely depends on how she's acting, but she's slower and stiffer. That could just be from the extra exercise. Do you find that it goes away after a week or two? Because then it's probably just temporary because of the exercise. But you could start giving her joint supplements probably in about 2 years, 3 years, I'd say. Just to keep her going. If you have more questions, Monica, you can send me a message. That's all I have to say about juvenile arthritis. I have a very busy rest of my day, so I do have to go. She'll also sleep for days, yeah. The only time I can get Kaya to move is when it's food time. And that's about it. So, it's definitely, she's not used to having that many dogs all the time. I think one time she went, it was March break, and there was 30 dogs there. So she had, as soon as one dog got bored of playing with her, she would just go and play with somebody else till like morning to night. They had to force her to inside to have naps because she would just pass out. But yes, that's all I have to say. If you have any questions, let me know, and I will see you later this week for an Instagram live.